On the topic of healthcare, as we know, the current COVID-19 epidemic has a huge impact on our society. It's changing the whole society. But the immediate impact is on healthcare and the frontliners. The government has to provide more funding for our healthcare system and to our frontliners, and also to invest more in the infrastructure to deal with the pandemic. Even before this pandemic, the healthcare system in Malaysia needs more investment, in particular in Sarawak. Sarawak and Sabah is lagging behind in terms of funding for healthcare facilities and also in terms of the personnel. I will give some example of the lag in the healthcare system in Sarawak. Recently, there were 102 permanent medical officers that were posted in Sarawak Hospital. However, less than 10% of these 102 medical officers were offered to MOs from Sarawak, to Sarawakians. More than 90% of these were offered to MOs from West Malaysia. And out of this, more than 90% that was offered to West Malaysian MOs to work in Sarawak on a permanent basis, 30 of them did not want to take up this post. They refused to be posted to Sarawak. They prefer to be in West Malaysia. And when this 30 permanent post was rejected, the opening was not offered to Sarawak's MO again. It was re-offered to another village of West Malaysians. When in fact we have Sarawakians MOs who are not being offered, are waiting for this position. It's not that we are lacking manpowers. We do have the manpowers, but we are not given that opportunities. And the other figures I will provide here to show how Sarawak is falling behind. Now, 39% of our clinic kesihatan do not have pharmacists, and all these are in rural areas. 152 out of 216, which is 70.7% of the clinics, do not have perkhidmatan mammo, that is the laboratory. And 192 out of 216 community clinics do not have X-ray services. Sarawak has only 7.1% of all the doctors in the country, 8.4% of the doctors in public sector, that is nationwide, and only 3.4% of the doctors in the private sector. Sarawak only has 6.5% of all specialists nationwide. The doctors to population ratio for Sarawak is 1 to 892. That means 892 people has one doctor on average in Sarawak. Compare this to Klang Valley, the ratio is 1 to 115. There is a big discrepancy within Sarawak itself. For example, Kuching Division has a ratio of 1 to 604, whereas Kapit is 1 to 1,721. Whereas Muka Division is 1 to 2,038. You can see the huge difference. During the Senate, I was asking the Minister of Health what is the per capita spending of healthcare for the country in general and also for Sarawak. This will surely tell the lack of investment. Now, for public health, in terms of human resources, the most critical specialist posts that need to be filled are family medicine specialists, whereby there is not even one FMS in Betong and Muka division. This situation arises as a result that most of the FMS were from West Malaysia posted to Sarawak, and there were not enough of these trained FMS Sarawakians. The critical shortage of specialization in Sarawak are the dermatologists, urologists, cardiothoracics, and neurosurgeon, plastic surgeon, and forensics. And this is why Sarawak seek the federal government to return the autonomy over healthcare as well as education to Sarawak government for us to run it ourselves. We believe we can do a better job in looking after these two areas for Sarawak. With the funds that the federal government allocated for education and for healthcare for Sarawak, that fund should be parked with the Sarawak government to run it. That's why we say it's autonomy. Delegate and return that resources to us to run it. We can do better, and there will be less grievances, as what I have highlighted just now.